Good morning, everybody. Sorry for the slight delay in starting the webinar just now. We're just waiting for everybody to join the room and then we will kick off. Brilliant to see so many of you joining us this morning. Just see quite a few people joining us in the room just now, so we will begin in just a moment. Super. Okay. Good morning, everybody. Thank you so much for bearing with us just now with a few technical problems. But welcome to the latest in our how-to series of webinars. My name is Katie and I'm the Director of Strategy and Partnerships at Mental Health UK, one of the UK's leading charities when it comes to workplace mental health. Now, today we're going to be talking about the links between mental health and physical health, and I'm absolutely delighted to be joined by my colleague Lucy, who is the Associate Director for Policy and Practice at Rethink Mental Illness. Good morning to you, Lucy. How are you doing?
Morning, I'm good, thank you. Thank you so much for the opportunity to join this morning. It's great to see so many people and to talk about this really important issue.
Absolutely. It's an absolute pleasure to have you with us this morning, Lucy. Now, before we get started with today's session, I just wanted to let you know that there is both a chat option and a Q&A function live for you in the Zoom session. So please do send through to us as many questions as you possibly can. We're going to protect lots of time to take those and pass them on to Lucy a little bit later on today. We're also recording this session and we will send this through to you a little bit later on today, along with any resources that we talk about as we go, so that you can rewatch the session and you can share it with your colleagues as well. So as I said, today we're going to be talking about the links between mental health and physical health and how to raise understanding and awareness of this in the workplace. Because just like physical health, we all have mental health, but these two things don't exist in silo. So today we'll be exploring the links between the two, as I say, and why understanding the links between the two now is more important than it ever has been before. Now, Lucy, I'm sure that there is an awful lot of content that we can cover today, but let's start by going with some of the very basics. How do mental health and physical health link with one another?
Yeah, absolutely. So as you said, you know, they absolutely don't exist in silo. There's a huge connection between our minds and our bodies, and we really can't have one without the other. So I think when I was thinking about this webinar, I was thinking about the last time I spoke to someone about my physical health, and then separately about my mental health. So, you know, if you can think about the last time you spoke to someone about your physical health, the chances are you would also have spoken about how that's affecting you mentally, you know, whether it's a broken leg and you can't get out and do the activity that you're used to doing, or if it's a long-term condition and, you know, having to deal with that every day. I have type 1 diabetes, so it's something that not only affects my physical health, but is something that I you know, affects me mentally as well. And because you have to think about it a lot, and it takes a lot of working out, you know, what insulin to give yourself, what to eat, and so on. And then likewise, last time, you know, we've all been affected by the pandemic. We've all been talking probably quite a bit more about our mental health, and how that has then impacted on our physical health. So I know I was chatting to my partner about how lockdown you know, the last lockdown, the endless lockdown that we've just been in, how that's been affecting my mental health, and how I knew that I needed to make time for walks every day, for example, to really help that. So I think for every one of us, there are real links between physical health and mental health. But then it's also really important to be aware of people who are living with more severe mental illness as a long-term condition. So things like schizophrenia, bipolar, and how their physical health is really impacted. And that is partly because of things like medication affecting weight gain, but also other lifestyle factors that help with sort of coping mechanisms around mental illness. So it's really, really important that we kind of work with colleagues, we understand that, and we really support colleagues with that.
Absolutely, absolutely. So some real sort of intrinsic links between the two there. And when we talk about poor mental health or mental illness and poor physical health, what's the sort of the prevalence? What's the overlap between the two?
Yeah, so it's really difficult to find like exact figures on this. I think what we do know is that general stat that I think a lot of us will be aware of, that 1 in 4 of us are affected by mental health issues in our lifetime. And the most common mental health issues are things like depression and anxiety. But then there will be a proportion of these people who'll then live with more severe mental illness, or complex, kind of a combination of mental health problems or mental illness like depression, but also at certain points in their life experiencing psychoses, OCD, as well as the sort of, you know, long-term mental illness like bipolar. And then also really important to be aware about how certain groups are more impacted by mental illness and mental ill health than others. So people from Black, Asian and ethnic minority backgrounds, people who identify as being LGBTIQ+ as well. Again, part of that is because of kind of structural issues and you know, systemic things like stigma and that all having an impact on mental health, which, as we said earlier, then in turn will then impact on physical health as well. So one stat that I think is really shocking is that people living with a severe mental illness are more likely to die 15 to 20 years earlier than the rest of the population. And this is largely due to preventable factors, really, like lifestyle approaches as coping mechanisms, medication causing weight gain. And I think, again, bringing this back to the pandemic, that will have all made things a lot worse because because other kind of healthy coping mechanisms like meeting with people, getting out and about, walking, physical activity, that will have all been really impacted by having to stay as close to home as possible or stay indoors.
Absolutely. So, you know, when we're talking about the sort of the prevalence, the overlap, and I guess the volume there, this has some real implications when we start to think about policy and practice in the workplace. And it feels to me like this is something that we should be talking about more.
Absolutely. I think that the only way we can address this is really by us all talking, because it not only means that we can be more aware and we can educate ourselves and, you know, share with each other. It also means that it creates that environment to be able to support each other and to support our colleagues. So people feel like they can be open and talk about their issues, but also what support they might need. And often I think it only needs to be something small, like a bit of time off to go to a health check, or you know, like regular making sure that when they book in their diary that they're having a lunch break, that is sacred time, and that's not for when other meetings should be put in. And that's not just because someone just wants to have their lunch, but that, you know, there are other factors that will support someone's physical and mental health as part of that. So I think talking about it more creates that environment, creates that support, and it can just have a hugely positive impact on individuals who are experiencing mental and physical ill health, but also then in turn for that office environment of being a nice place to work and a supportive place to work where people want to continue working for that employer.
Absolutely. So it's really something that isn't just about the employer, it's about the managers, it's about the colleagues, it's about getting that message kind of broadly disseminated across the organisation, because as you say, it can be relatively small things that people can do in the workplace that can actually have quite a profound positive impact on people who are experiencing both poor mental health and poor physical health. And so, Lucy, I'm wondering, can you talk to us about sort of any examples, either from within the workplace or elsewhere across some of the activity that you do, that you've seen some really good communications when it comes to the links between the two?
Yeah, well, there is a huge amount out there. I actually spoke to my team and asked what they had come across in their experience, not only working for Rethink, but also in the past, and there's so much best practice out there from, you know, big corporate organizations like Unilever, as well as like the experts in the field like the NHS or Sport England. So I think that whatever organization you work at, there's probably going to be something that you can work from that really relates to your sort of organization. One thing that we at Rethink Mental Illness do is that we have a wellbeing ambassadors group, and it's a really good example of how employees, so it's really employee led, and an employee or a colleague from each team come together and steer change in the organisation. So at Rethink, the wellbeing ambassadors group supports HR, so they work with HR and they work with the organisational development lead to produce different initiatives, guides, resources. I'm not actually on that group, but as someone who receives, you know, is on the receiving end of this, I then get emails and really amazing. You know, there's a lot of work that's gone into it where it's sort of designed up, and it's really engaging, and it's quite regular as well. So even if one doesn't really appeal to me or doesn't kind of talk to my issue at any one time, for example, there is a current focus at the moment on support for staff with a cancer diagnosis and menopause awareness training as well. But I know that, you know, coming up, there'll probably be something else. For example, with that first lockdown during winter, there was a lot going out about how to do some kind of exercise, even if you don't want to go out in the rain or the snow, as we had. And really, yes, again, it's kind of initiatives that people can pick and choose what they want to do, but it's also about creating that environment that people know that they can talk about their physical health and their mental health, and find support, whether it's from the organisation as a whole or to be able to have that one-to-one support from your manager. So yeah.
And I think you've touched on a really interesting point there, and it's something that comes up again and again when we have these webinars, is about the importance of some of that communication, not just coming from the leadership, but also coming from the individuals as well, because we all experience our own mental health and our physical health and well-being in very different and unique ways, and one fit for an individual mightn't be the same as the other. And the broader that you get that suite of voices talking to the individuals, the more likely you are to resonate with the individuals across the organisation. So I think that's a really interesting point there. Absolutely.
Definitely. Yeah, and I think that there's quite a few different ways, like thinking about employers and what they can do to help. So if we think about our what affects our physical and our mental health in a positive way, a lot of that revolves around things like physical activity, sleeping, eating well, and a lot of how you address those three things, you know, that's individual, that's up to individuals to address, but there's an environment that we can create as employers. Lots of things which aren't rocket science, it's things that just need to be thought through. So it's how to support colleagues in these three areas and enabling that culture. For example, you know, healthy options at cafes, flexible working practices, recognizing that this has to, of course, be within reason, and it's really important to allow staff to be able to put in place those coping mechanisms as well as getting the work done. And then promoting the benefits of physical and mental health, so having like wellbeing champions, walking meetings, putting on, you know, meditation classes at lunchtime. And then so that's something that I think employers as a whole can do, as well as then having the sort of policies in place for managers to be able to support reports on what sort of reasonable adjustments should and need to be put in place. Again, specifically thinking about people who are severely affected by mental illness, reasonable adjustments that are just absolutely vital. And that's something that we talk about a lot within Rethink. And it's things like time off to ensure employees can go to NHS health checks, and follow-up support and interventions. Again, flexible hours for staff maybe who struggle to sleep, but recognizing, you know, that this is a two-way street and work needs to be done. So trust is, I think, absolutely vital within that, creating that trusting relationship where the employee trusts the employer to know that they can, that they have the ability to be able to go and go to appointments or whatever it is, but the employer trusts the employee as well to do the work.
Absolutely. And I guess we talked about the importance of understanding these links between mental health and physical health now as being something that's incredibly important. And I think you're talking a lot there about sort of the need to plan and to put into place considerations around some adjustments and some sort of positive activities in the day. And I guess a lot of organisations are grappling with the concept of getting back into the office at the moment. And so it's about individuals who are on this call today considering as they go through that process how they're weaving some of these pieces back into the workplace, both in the physical context, but also where people are continuing to work from home on that kind of remote basis as well, really. So no, I think that's really helpful. And Lucy, what do you think? So that's really helpful in terms of employers, and I've taken a couple of notes there to by means of wrapping this up a little bit later on. But in terms of sort of champions in the workplace and sort of colleagues supporting each other on a peer-to-peer basis, what do you think would be some of your sort of advice and tips for individuals in that regard?
Yeah, so again, I spoke to the person who is one of my colleagues who is one of our wellbeing champions, And I think really importantly, it's about working together to co-produce what the solutions might be. So understanding those barriers to participation, or barriers to addressing your sort of physical and mental health within an organisation, and then working together to co-produce, co-develop initiatives that can help employees address those. So it's not, people in the senior management team deciding or like thinking they understand and then, doing a sort of top-down approach, but it's really employees working together. So workplace champions leading that and getting information and getting ideas and thoughts from team members, and then really making the most of using internal communication channels to make sure that they're getting it out there. And I think one other thing that was suggested is around setting up a buddy or a partner scheme to help with like accountability and motivation, because as I said, employers can only do so much. This is really about personal responsibility, and sometimes that can help if you have a trusted colleague, a buddy or a partner who you can work together to make sure that you are taking lunchtime walks, and you are making sure that if you're blocking out time that you're keeping it, or you're going to the meditation classes together, or you're finishing at 5, whatever that is, that you make sure you work together on it, especially if you know yourself that you're a real kind of, once you get your head down in work, then that's it for the day, especially all working from home at the moment. I think it's hard to find that separation. So I think workplace champions acting not just on behalf of the organisation, but also on behalf of individuals as well, working together.
Absolutely. And you've touched on another fantastic point now, which is the importance of kind of that cross section across the organisation, utilising the skills of your comms team, which is actually something that popped up when we had Pure Gym join us in one of our webinars earlier on this year. Is actually you've got a lot of skills and innate talent within the organisation to promote the business externally, but actually using that to the benefit of some of your staff as well is really quite important. So no, this sounds really interesting. This is really helpful. So we've talked about a number of things there already in terms of sort of hints and tips that people can take on in the workplace. You sit within the world of policy and practice at Rethink Mental Illness, and I'm sure you do a lot of reading in this sort of subject matter area very regularly. Often off the back of the end of these webinars, we like to send out some resources and some further literature to people who have attended. What would you suggest that we can send out at the end of today's session?
Yeah, definitely. So we can share some sort of other organisation ideas that others have done. But I think also what's really useful is the guides from like the NHS and from Sport England and from NICE, because they're really, really evidence-based. They're based on what can really improve, taking that holistic view across physical health and mental health from a prevention point of view. There's a huge amount. So Public Health England as well have produced resources. So I think there's a kind of national body advice, and then there's also some best practice examples that we can share as well.
That sounds brilliant, because often it's taking that first step, recognising something else that an organisation's doing that you can replicate in your own environment. That's really important. That sounds great. Now, we've already had a couple of questions come through to us on the Q&A function, but please do keep on sending those through. We've got Lucy's time here, so we ought to make best use of it. But I'll kick off with some of the questions that have come through, if that's okay. And one of the questions is around the importance of active travel and active commuting. The question suggests that this is something that the organisation would like to introduce into the workplace, because it would also help with social distancing as the organisation returns to the office. Is this something that you would encourage? And do you have any recommendations on setting up the workplace so that it's conducive for that?
Absolutely. I think all of this is about as much choice and enablement as possible. So if there are people who, at no point do we want to kind of force anything or stipulate that this is the only way forward. By way of an example, active travel into the office, although I doubt that would ever be the case, but it's just about enabling that choice. And then something that we have within our offices at Rethink Mental Illness is showers and locker space, so that people, and then a bike lock shed as well. So even though we're in the centre of London, people feel confident that they can leave their bikes outside. So I think some of these probably do take a bit of investment and a bit of thinking through, and thinking it's not just about saying to staff, we will encourage active travel, but it's like, what can then the organisation do around that, to show that it is that two-way street, which I think in turn then just pays dividends in people feeling like they want to, they feel valued and they want to stay at the organisation.
So a little bit of investment required perhaps, but relatively low level for the, as you say, the return, the dividend that the organisation can get back. That sounds great. We've got a question here from James. It said, what is the best way that you would recommend organisations address the unique intersectionality of mental health? When so many approach and think about mental health with a broad stroke or label of depression, support instead of prevention, etc. I think that's a great question.
Really great question. It's so complicated and complex, and I think we've made so much progress over the years on talking about mental health. But what we talk about quite a lot within Rethink Mental Illness, which we are the charity for people severely affected by mental illness, is that more about, are we raising awareness and kind of lessening stigma in a really, really positive way when people are talking about anxiety and depression, but it's still not quite there. When we talk to people living with severe mental illness, they still face stigma every day, from organisations, but also from employers about their condition, like schizophrenia, bipolar, and then the kind of intersectionality and the lack of understanding about how that affects physical health and often sort of multiple conditions. So what I think we learned from the sort of anti-stigma campaign, so Time to Change, is how important they are and how important it is to talk about it and to raise awareness. And often that does need to be bottom up as well as top down. So employees talking about it and raising it, and again the Wellbeing Ambassador Group being a great way to do that, but also employers really working to understand what this means and educating, and in the same way I think everyone has done, or lots of people have worked over the last year to really understand what we're talking about when we're talking about racism and people who are from Black Lives Matter movement, and I think that's what we need to do. To so much of that is a sort of grassroots push to make sure that people are recognise the issues, but then it has to come from employers as well.
Absolutely. And touching on the concept of wellbeing ambassador groups again, we've got a question from Hansi. They say, we love the idea of the wellbeing ambassador group. How was this established? Nominees, volunteers, and do they get dedicated release to do the role? So time out to do the role in their organisation.
Yeah, so I think I don't know for sure, but I think it was an initiative that was set up by HR, and then a request out to teams to put forward an ambassador from each team. So it was really volunteers. It wasn't anyone necessarily being nominated, but recognising that they did want that cross section across all of the different departments within the organisation. And then absolutely, making sure that they can balance that then with their day job as well. The person who's in my team, who's a wellbeing ambassador, it is quite flexible, and we haven't had to have a sort of conversation about you need dedicated time, like one day a week to do this, because it is a bit more flexible than that. But equally recognising that when that time is in his diary, that he's going to a meeting about wellbeing ambassadors, that's a non-negotiable. It's not like I can say, can you move that because we've got another meeting. That's really, really important.
Absolutely, it's got to be at the heart, hasn't it? It's got to be fundamental to what those individuals do. And actually this is a really good question that's come through to us, and one that I've seen presented at a number of conferences that I've been to over time, in particular around sort of the self-nomination process or volunteering to be on wellbeing groups. And the one piece of advice that we would often sort of put alongside that is to ensure that individuals who are nominating themselves to be in these kind of roles are comfortable and well enough to look after their own mental health before they're stepping into the breach to represent or support other people in that space as well. And so sort of I would personally recommend a bit of a sort of a hybrid approach of self-nomination, but also with a bit of selection around the fringes of that as well. So super, thank you. We've got another question that's come in to us here, which is, what do you think about employers expecting participation in lunch and learns, as an example?
So I'm assuming this is a question about about the organisation putting on initiatives like lunch and learns, and then expecting people to participate, and there being that expectation where if there isn't the participation, then there's kind of known disappointment that people aren't attending. I think my experience as someone who has, you know, worked in many organisations where they run things like lunch and learn initiatives, or lunchtime sessions, wellbeing sessions, meditation sessions, that sort of thing, is it really does depend what the topic's about. I think if it's about supporting staff with their mental and physical health, so things like meditation or walking meetings, that sort of thing, then that absolutely has to be up to individuals to be able to go along to. If it's about something like a lunch and learn, which is about addressing stigma or understanding more about, you know, severe mental illness in the workplace, or understanding intersectionality between that and other people from, you know, different backgrounds and cultures, then I think that is something that is so important that we all need to learn more about, and we all need to support each other on. That actually, if that's a kind of priority for all of us, priority for the organisation, and it's really about trying to demonstrate the importance to the organisation about addressing that, then there really should probably be a level of expectation about at least, you know, members of staff from different teams going along, and not just, you know, one team who then learn a load and do a load, and then it doesn't lead to the change across the whole organisation. So I think for something that's a sort of well-being idea, no, but for something that is about education and learning more and seeing how we can all work together to support each other more, then I think it doesn't have to be every single person going there. You know, other people have annual leave and lots of other things going on, but definitely representation across different teams.
Absolutely. So it's recognising those key pillars, the messaging that you want to get across to everybody, but again, allowing that element of personal choice around the edge.
And recognise that's just my opinion without all the knowledge of what we're talking about here.
Absolutely, absolutely. A question here from Darren. Darren, I feel your pain. So Darren, his company has about 280 staff and will be growing dramatically in the near future. He started wellbeing bulletins recently and has created an intranet wellbeing hub, but take up has been incredibly low. He says that he will continue, of course, to promote the courses and the activities. And if 5 people are helped, then that's at least a win. But any sort of thoughts and ideas to encourage take up?
Really, really difficult question. I think that is probably really common, particularly when we're all working from home and we're all working remotely at the moment. And there's perhaps, you know, probably indicative as well of people feeling slightly more disengaged because of the lockdowns and needing something to really engage them back in again. And I think there is probably, so again, not kind of understanding the organisation or what your role in it is, but there's something about going to people and asking what they want. So going, you know, arranging to have one-to-ones with people or doing a few focus groups and asking managers to select people to join those focus groups so that you can really understand how, you know, what is the baseline of the well-being in the organisation at the moment, and what are the things that are going really well, but what are the gaps, particularly as we're at this junction where we're coming out of lockdown and we're starting to go back into the office, and using that as the reason why this is so important that we get this right, and that managers make sure that they can protect time to make sure staff can go to those, and then using that to then understand what the barriers are, but also what are the key things that need to change. Maybe it's not having emails, maybe it's not you know, some of the initiatives that you have put in place, maybe it's something completely different, or maybe it's just something at the moment really focused on post-pandemic, what we can all do. So it's about trying to co-produce and seeing them as, without necessarily naming them as wellbeing champions, seeing these focus groups as the start of maybe wellbeing champions, and then working together to develop what can then you know, really get traction within the organisation, as well as then making sure that it is really, you know, the senior management team are really on board with this and cascading and making sure that they're really pushing this as a top priority agenda at the moment, and pushing engagement with it, I think.
Yeah, it's definitely an evolution and a journey, isn't it? So you know, definitely keep up the effort, Darren, and I'm sure you'll get the return on it shortly. And actually, we've just had a comment back from Hansi here that said agreed. We have mental health first aiders who are doing a great job at the moment, around 50 in a business of 15,000, so a drop in the ocean, but something that they're going to continue to work on. We've got a question from, they're all coming in now. This is absolutely fantastic. We've got a question from Trevor. Morning, Trevor. Trevor says that the concept of physical literacy, as described by the International Physical Literacy Association, identifies that sport and physical activity impact across all areas of human existence, the physical, the emotional, and the cognitive domains. So the question is, how do you feel that mental health and physical activity providers could best collaborate to have maximum effect?
Really interesting question. So not fully understanding where that has come from, or kind of the driver behind that question, but when we're talking about mental health and physical activity providers, when I think of physical activity providers, I'm thinking of gyms and organizations like that who facilitate people to do physical activity and also run physical activity interventions. And I think that's where so we, as Rethink Mental Illness, have talked a lot about what reasonable adjustments need to be put in place for people living with mental health problems to be able to not just access physical activity support, which is so incredibly vital and important to their mental health and their physical health, but also to feel supported when they're there, and to feel like they're aware of what they can do. So it's not just necessarily going to a gym or going to a class, but there's potentially an element of peer support there. So there's other people who are going through what they're going through, or living with mental health problems or severe mental illness. There are reasonable adjustments in place where there's kind of flexible start times, because there can be issues with people feeling like, nervous about going along, anxious, agoraphobia, feeling anxious to leave the house. So potentially also something around bringing it back to the community, if there are sort of hubs of physical activity provision around the country, and then doing something back in the community as well, which I think in turn can then help, if people are part of something that is been run by a physical, I'm just sort of thinking off the top of my head, but been run by a physical activity organisation, but maybe a bit more local, then that in itself is pretty good self-promotion to then get people back into their sort of main hub. We at Rethink, we run a physical activity peer support project, which is all about basically essentially proving the hypothesis that people living with severe mental illness or mental health problems are much more likely to carry out physical activity if there's an element of peer support as part of it. So there's not only the chance to kind of talk to people who have or are experiencing similar mental health problems, but also everyone, there's no issues with people turning up late, and everyone can kind of support each other. So I think peer support is coming out as one of our biggest solutions to some of the barriers that people living with mental health problems face in accessing physical activity.
And it feels to me that now is absolutely imperative when it comes to collaboration. I was listening just this morning to Seb Coe on the news talking about the importance of getting parkrun back into our communities over the coming weeks and coming months. And what on face value seems like something that's relatively simple and straightforward to do is actually going to require businesses to come together and support sporting and physical activity organisations like Parkrun to really get back into the fore, get that innovation into the sort of the systemic design of physical activity so that we can overcome social distancing and get some of that back in place. Great. We've got a question here from Stacey. Morning, Stacey. My site has worked through the pandemic, and after speaking to several staff, I have noticed an increase on sleep issues and exhaustion, something we've seen a lot as well actually at Mental Health UK. What could we do to support these individuals?
Yeah, we've definitely seen a lot of this. So something that I do as a manager of a team is have flexible working practices in place. So there are, for people who are currently or have in the past experienced sleeping issues and exhaustion, having a sort of reasonable adjustment in place that's agreed with that individual, where they can flex their start time, so start a bit later, or be able to take toil, which is time off in lieu that maybe they've accrued at previous points, and to be able to use that to catch up on sleep if they need to. There is obviously that kind of two-way expectation that the work gets done, or that there is an option of handing work over, so that it doesn't sort of mean that the rest of the team suddenly get loads of pressure on them to do some of that work. But I think it's about particularly recognizing that this is probably just going to be a particular point in time, and that it's not necessarily something that's going to continue for a really long time, hopefully not, although we may see peaks and troughs of it. It's so much better to, like, it's so brilliant that you recognize that, and it's so much better to put in place some sort of flexibility and reasonable adjustments now, to show what you're doing as a kind of manager, to support team members, which I think again will then pay back dividends with people feeling trusted and supported, and making up the time, making sure that they do the work. But no employee who has not slept all night is going to be performing their best. So it's so much better just to address that, I think.
Absolutely. And Stacey, I'd point you towards the sections on the Mental Health UK website about burnout. We've conducted some research back in October last year, and we reconducted the same research in March this year, and we found that when it comes to burnout, of which sleep deprivation and exhaustion are clear sort of signs of, that we're still in a very heightened level when it comes to stress in the workplace at the moment. And there are lots of resources on the website that you can use that start to break down some of the understandings around the causes of burnout, recognizing those signs and symptoms in yourself as an individual or in your team, and then how to take some of those pieces forward. So we'll send a link to that as we send out the link to this webinar later on today. And then a question from Dominique. As a very micro team, 7 of them, in a very stressful sector, they find it difficult to try and encourage wellness, as this is all about small businesses. I think this is because we are so close. Maybe this stops the team members coming forward because we are so small. Any tips on how to manage and get small teams to discuss and move forward in the space of mental health?
Yeah, this is definitely something that I've come across as well, working in a small team who are just incredibly busy, and there being real pinch points that feel like they last for a really long time, where we've got contracts to meet and external deadlines to meet and expectations, and it is really challenging, because as a manager I find myself saying, make sure you take some time, and them going, there is no possibility that I can take some time or some holiday because there is so much to do at the moment. I think what the first thing that I've done, kind of setting up a new team, really, is to have an hour and a half. So in the past we probably talk about having an away day or an away morning, but that not being possible, and having to do it via Zoom, making that a bit more condensed. So having just an hour and a half of kind of dedicated time to get together and talk about ways of working, and to start with a bit of a fun, like, icebreaker. Sounds cheesy, but it definitely works, even when there were skeptics in my team. And then to try and really dedicate that time, having a bit of a 3-line whip to make sure everyone's there, to then talk about what are issues people are facing, what are some of the solutions, again doing that kind of co-production, and finding there's lots of ways. I was looking up online before I did that session about kind of creative ways that you can all talk about it without recognizing that some people are better than others about talking about their well-being. So that is a bit of a starter, and then from there trying to identify some quick wins that you can put in place, as well as some of the longer term solutions. So quick wins really being about what can we do when we're in pinch points, when we're in these real crunch periods where there's so much to do, that we can then support each other on, and or having a sort of red lines that we just will support each other to not go over a certain period of time in the evening where we work, or waking up at a certain time or whatever it is. And then longer term solutions in place to try and get on. you know, to look at that planning and to look at where those peaks and troughs in capacity are, and trying to make sure that during the troughs that's where you can really just take holiday. I know it's not easy, and it's hard to kind of give practical tips not knowing what your organization is or what you're doing, but I think it really is about trying to work together on it and encouraging discussion.
Yeah, I think one thing that's really bizarrely sort of reassuring listening to you talking today, Lucy, is to know that even when you're sitting with all of that best practice and policy around you, as you are in Rethink Mental Illness, that it's still a challenge for you, sort of bringing that all together. There's no silver bullet to this that anybody's missing out on. And it's something that we'll continue to work on together. But Dominic, we have also some recent research and resources for small businesses as well that we'll be bringing to the fore through Mental Health UK over the coming months. So please do stay in touch with us, and hopefully we will have a little bit more for you there. Goodness me, we have had an absolute wealth of questions from the audience today. I'm absolutely thrilled to say that I think we've managed to get through the majority of them. Some of them did overlap in a couple of places, so apologies if I didn't ask your question directly, but hopefully you were able to elicit the answers from some of the conversations that we've had already. It's been an absolute pleasure to have you with us, Lucy, and I've made a couple of notes actually of some things that I think that we can share with the audience off of the back of today's session. We talked a bit about sort of reasonable adjustments, and I suspect we have some guidance that we can provide around that. We talked about case studies from the NHS, Sport England and NICE in particular, so we will get those out to the team, to everybody as well, and also some of the recent research and guidance that we've had on burnout. But was there anything else in particular that you think would be useful sharing?
Yeah, we'll definitely share some of the Rethink resources as well, and some of the work that my colleague Barry and Mel, who run our physical activity project, I think there's so much learning from there, and some tools that we'll share as well. And also I've actually just seen a point from someone which is about mental health often being framed in negative terms, and I think that I just wanted to kind of end, if I can, just on that being so important, that there is so, you know, when we talk about teams and different things that people can bring to teams, there is working for Rethink Mental Illness and working with people living with severe mental illness, there's so much we can all do to work together that is just brings so much and really leads to such a better outcome and outputs, I think, for organisations. And it's so important, yeah, to talk about to understand that and the positives, and really overcoming that stigma, so it's not just seen as a condition or an illness that needs to be addressed, but it's about, yeah, every team member bringing something to the organisation.
Absolutely. Listen, Lucy, thank you so much for your time today. As I said, we'll send this link to this webinar along with the resources that we've discussed out to all of the delegates a little bit later on today. This is one of a series of webinars that we're doing around how to in the workplace. If you want to take a look at our back catalogue, that's on the Mental Health UK website. Our next session is going to be on the 18th of June at 10 AM, when we will be talking about how to support colleagues through and after negative life events, where I'll be talking to Liam Southam, who is in the criminal justice team at Rethink Mental Illness. And I'm really excited about that session, because we'll be talking a lot about grief, acceptance and change, which is obviously something that so many of us have experienced over the past year to a varying degree. So some really interesting conversation coming up in that one. But again, thank you everybody for joining us today, and we look forward to seeing you again in a month's time. Take care.